Health Workers Union Nehawu is visiting hospitals in KwaZulu-Natal today to highlight the rising number of healthcare workers contracting COVID-19. Some healthcare workers have died from the virus. eNCA's Tuba Vilane following that story for us. Tuba, very good morning to you. And just give us an idea of what you're hearing about the health of healthcare workers and what they're being put at risk of.
Yes, good morning. We're here outside this, the Chief Albert Hospital in Durban. What we understand earlier on it was that the leadership of Nehawu, led by its president, Mzwandile Makwaiba, was going to visit the institution following the number of cases of COVID-19 among the staff workers here at the hospital. But when we arrived here, we realized that, in fact, there is also a protest that is led by workers. Maybe I can step out of the shot so that you can see behind me. These are the workers that are protesting. If I look on the placards that they are carrying, some are talking about the high wage, others are talking about that they want to get tested. As we understand that in many institutions, workers have been complaining that even if there are workers that have tested positive for COVID-19, but the rest of the staff that have been in contact with that staff is not tested. But let me now bring in the president himself to understand the part of his visit and the protest. Thank you so much, President. Just take us through. We understand today it was a visit by Nehawu, and there is this protest. Can you give us the understanding of what is happening?
Well, we have been taking a program in all provinces. Just that in KwaZulu-Natal, as me who's here, the other office bearers have gone in other different provinces. But what we have come across in the province is a reflection of the whole country. At the center of the problem is a leadership in the Department of Health. The issues are not necessarily new, neither they different from each province. It's exactly the same. Classical example, if you are in casualty and one worker in casualty test positive, we don't see measures that we're screening the other colleague that have been there in order to make sure that we manage the spread of coronavirus. It is the attitude of the management. For instance, here I'm told that when one nurse was tested positive, instead of compassionate of management, she was accused of moonlighting. What does moonlighting have to do with a worker that is affected by coronavirus? Because moonlighting has been happening before the coronavirus. It was never condemned. Perhaps the same nursing manager who does the possibilities that herself do moonlighting. So the issue really is the whole issue of leadership, quality, ability of leadership to manage the situation. The other problem that is growing in the Department of Health is an old issue, the issue of shortage of staff. For instance, in this hospital we were told that more than 100 nurses are affected. But yet, before, this hospital has been having a problem with shortage of staff. If you are going to quarantine those nurses, how are you going to have staff members being available to perform their responsibility, particularly in the crisis of coronavirus? So what we get here as our visit is something that we have not organized. We have nothing to do with this protest. We just came a program. We were in Maritzburg yesterday. We just came this morning and we come across the protest. It's a frustration of our members towards the management. And the problem, it does not only at this level. It's this level, it's the province, it's national. For instance, this is the biggest union in the public sector. Very big union. But guess what? The last time we met the minister was the 8th of April. He was supposed to come back to us We're supposed to get minutes of those meetings. We're supposed to have a following meeting. Up until today, he's been running away from us. And we're no longer going to chase him. We're not going to chase him. We're simply going to deal with issues the way we understand, and we're simply going to talk to our members. And we will do our own bit in order to protect the union members. Because at the center, the critical part of what is creating the frustration is that you're going to work and leave your family, you want to come back and be together with your family. When you come back, you're no longer capable of looking out your family because you are sick, you are infected by coronavirus. It becomes more frustration.
President, very briefly, now there is this protest that coincided with your visit. What are you going to do now?
Well, I suppose, being a president of such being union and being the president of international the world, I must devise means of diffusing the situation so that it allows us to engage management. I have been briefed by the regional secretary. I've been briefed by the branch secretary. I've been briefed by the provincial secretary. We're going to meet and get more briefing, and after that we're going to meet the management and see that we can resolve this thing. Some of the issues that are raised here are not going to be resolved at this level because, again, the leadership level and the problem of leadership in the Department of Health, it follows the hierarchy of the structure and the bureaucratic approach in how to deal with this thing. I just want to say the issue of PPEs, it has exposed the ability of Department of Health in this country to manage crises of this nature.
Thank you so much. That was the president of Nehawu, Mzwandile Magwayiwa. As we understand that the protest that is currently taking place coincided with his visit. We understand that after this hospital, they are going to St. Augustine Hospital. That is another hospital that has seen a rise in the number of infections, especially among the workers, that led to its closure a few months ago, and subsequently it was reopened.
We do take our healthcare workers for granted, especially at times like this. Thanks very much to Babelane.